So who's at risk? Is everybody at risk?
Well, when we talk about women in 1 in 8 being diagnosed in their lifetime, we're talking about if women live till they're 80 years of age. And what we know is that women actually are at higher risk the older they get.
Whoa, so age is one risk
So
factor.
age is the big risk factor. The other big one obviously is being female, way more common in women, which is why we talk about it in women so much. But I have to be cautious and make sure that men do understand that if they were to detect a lump, that they need to be cautious as well, because it is still possible for men to be diagnosed with breast cancer.
So men get it, women get it, it's more common in women. Excellent survival rate if you find it early. Other risk factors other than age. So you don't stop getting your mammograms at age 60 and 65.
No, and really truthfully, that's sort of one of those things that we counsel women on a lot. You know, as we age, we know that women between 60 and 70, about a 30% chance are going to be diagnosed with breast cancer. The 30% of breast cancer are diagnosed in that age group. So the older you get, the actually higher the rate of breast cancer. But the hard part about it is that we do end up with other diseases that sometimes become more prevalent, more prominent, and more likely to be of greater concern when we're talking about balancing that with the diagnosis of breast cancer.
So as far as breast cancer goes, other than age, what are some of the other things like age of menstrual cycle, about when you go through menopause, and when you tell me about all
So
that.
other risk factors are if you had started your menstrual cycles very early, or if you go through menopause really late. So therefore you're going to be exposed to your hormonal cycles for a much longer period of time if you start early or end late. Other risk factors would be a first-degree relative who's been diagnosed with cancer. Now, fortunately, the vast majority of women who have a first-degree relative still won't develop cancer, but they definitely have a higher risk.
How about if somebody's had breast cancer on the right side? What are their chances?
They're definitely going to be at higher risk for getting a cancer on the other side. So if you've ever been diagnosed with breast cancer, you're at higher risk. Women that have very dense breast tissue are at higher risk, and we think that's in part because that tissue is more concentrated. There's more of it there.
So increased breast tissue density.
Yes.
Is that in big busted women, or you can have high density in the little breast?
It could be in either one. We do tend to see it a little bit more commonly in women who are of lower weight, but we know that obesity actually increases your risk of breast cancer as well. And there's a thought that it's because the fat cells convert peripheral hormones to an estrogen that actually increases the levels of hormones that circulate in the body.
So it's the estrogen that's really, in general, stimulating. So that's start your menstrual cycle early, you end menopause late.
Yeah.
That's because you're exposed to estrogen.